Hi guys, and welcome back to my channel. If you are new, then please consider subscribing and share my videos as much as possible. So a lot of you have asked me on tips for time management or how to take out time for studying after a long day. So this is my wind down routine after a long day. I came back home at around 5:15 or so. We dispersed at 4:40. So this is a typical Monday of mine. In a week, 3 days we disperse at 4:40. One of them is Monday. So on Mondays I disperse late, that is at 4:40, and by the time I reach home and get into my bedroom, it is already 5 or 5:15. So I just try to wind down and I don't do any rigorous activities just as I come in, such as going for a jog, etc. So I just sit down, eat, and read a book or scroll through mobile while eating. So here I am reading the book Atomic Habits. It is by James Clear. This book mainly focuses more on not just creating a habit for a certain period of time. This book says that you create your identity such that those habits, they shape up your identity. You are recognized by your habits. It is something that you don't do temporarily, but you make them your lifestyle. So that is all this book is about. And if you want it, you will easily get it on Amazon sales. I guess now Christmas sales would be up, so you can get it. It is Atomic Habits by James Clear. So after around 20 minutes of reading the book and completing with my food, I sat down to write my notes. So here I am writing my notes on HPTLC, anti-malaria, psoriasis, and drug-induced renal disorders. In this particular time lapse, I am writing notes on HPTLC. So here not exactly the notes, but I am attempting the previous year questions. So these previous year question answers, they are divided as 6 marks, 5 marks, chapter wise the division is provided. So there are chapter wise and mark wise questions with their answers of previous years, and all this material you can get along with my notes. And if you want me to share my notes, you can simply mail me at patelsakshi164@gmail.com. I have notes of first and second year, and those are the notes from which I studied. So I'll again let you enjoy the time lapse.
Uh, 8:01 p.
Hi guys, so I'm already completed with my dinner and I've also completed with anti-malarial chapter. So now I guess first I will take HPTLC and then drug-induced renal failure, and then at last psoriasis. Psoriasis is very easy, and yeah, mainly psoriasis only has like the definition, etiology, and then what are the risk factors, and it has mainly the classification is important. There are, I think, 7 types of psoriasis. So that, and then it's a therapy because it is of pharmacotherapeutics. Drug induced renal disorder, it is also pharmacotherapeutics. It is similar to the chapter in pharmd second year, which was drug induced pulmonary diseases, I guess, which had COPD and asthma and all that. So yeah, it is similar to that. So last time in the last vlog I discussed SLE. Yeah, so at the end of this video we'll do an
a case study from ortho. It is the diagnosis is of a 2-year-old case of osteomyelitis presenting with, oh, this is my favorite patient, presenting with acute exacerbation. So there was a 17-year-old girl and she was diagnosed with osteomyelitis. She went 2 surgeries and she is my favorite patient. I mean, she was rude but the case is interesting. That is why I'm saying that she is my favorite patient. Now, actually, I can't wait. Let us do the case study right now. Okay. Wait. There was a patient of 17-year-old. She came in to the OPD with the complaint of itching and high pulse. She has no history of high blood pressure, diabetes mellitus, or any CVS related problems. So, and the medication history she had was amoxicillin and potassium clavulanate, muciprocin ointment, and vitamin C chewable tablet. So amoxicillin, potassium clavulanate, they are oral antibiotic, and muciprocin ointment, that is tea-backed, it is topical ointment. So the thing is that she already had osteomyelitis, but when she presented herself to the OPD, it had aggravated. So ESR was done, and the normal sedimentation rate, it is 20 mm, while the patient had 92. Now the ESR sedimentation rate, it increases when you have any kind of inflammation. So that is 92 in her, while normal is 20 mm in the first hour. That is standard. 20 mm in first hour is the standard ESR, where she had 92 mm in first hour. So it increased because of inflammation. Radiograph of thigh was done. So multiple involucrum with periosteal thickening noted in right femur shaft. This is suggestive of osteomyelitis. So she had undergone an surgery, and then post surgery her drugs were paracetamol, and then paracetamol and diclofenac. Yeah, paracetamol and diclofenac were given because obviously of the pain. In any kind of ortho case, you will see diclofenac is common. So paracetamol and diclofenac, then lactic acid bacillus and clindamycin and cefuroxime. So cefuroxime, it is second generation cephalosporin. So that was given to her because clindamycin, it is given in gram negative in osteomyelitis, I guess. So because it is antibiotic and she is having osteomyelitis. Now osteomyelitis is infection of the bone. Myelitis means infection or inflammation. Itis means inflammation, or hepatitis, serositis. So itis means inflammation, osteo means of bones. So this is inflammation of the bone caused by some kind of infection, some kind of bacteria. So that is why she is given lactic acid bacillus, clindamycin and cefuroxime. Now also because she is given NSAIDs which can cause peptic ulcer, and she is just 17-year-old patient, so she has high chances of getting peptic ulcer. So that's why, to protect her gastric mucosa, we also give pantoprazole. NSAIDs provoke ulcer because of the high acidity of stomach. So when you lower the acidity of stomach, you lower your chances of getting ulcers due to NSAID. And then of course she was given ORS post surgery, that's why, and vitamin D. Now she is taking vitamin C and B tablets and heparin sodium to eliminate any chances of coagulation or thrombus formation post surgery, that's why. So this is her medication chart. So that is it about. So sorry, I'll cut that part. I took the patient's name. I'm sorry. Okay, so that is it about this patient of ours. Yeah. So in case you would like to see, by the way, also there are SOAP guidelines that we have to follow while we are making any case-based presentation. And one more thing, a lot of you think that I am South Indian. A lot of you ask me questions in the comment section in Tamil, Telugu, Kannada, etc. Now I am not from South India. I am Gujarati. I am from Gujarat. I do understand Tamil a little bit, but for the other languages or even for Tamil, sometimes I have to ask help. So I know a lot of my subscribers are from South India, that is why I always converse in English. But it is a request to write down your comments or questions or suggestions in English or Hindi, whatever suits you, so that I can interpret them easily and I can reply to you. So yeah, that is it, and I'll see you next time. Till then, bye bye.
just to justify my obsession with empty pens, like these are literally all the empty pens that I have, these many, and these are of less than, I don't know, but they are kind of recent. Okay, it must be 3 months. Yeah, these are of 3 months maximum, and this is what we have. So I really like all of them are empty. Okay, it's not कि मैं ऐसे ही दिखा रही हूँ, सब खाली पड़ी है. And I had bigger stock, much bigger than this one, at least thrice the size, that I already gave up. And now we are stocking again. Let us see how far we reach. इसका ढक्कन नहीं है तो मैंने किसी और का लगा दिया. अभी इसका भी ढक्कन घूम गया. ये वही पेन है जो आज खत्म हुआ. So yep, that is it. If anyone has obsession like this, then let me know in the comment section below. I know I'm not the only person. If you're someone who watches Flying Bees, then recently even Gaurav said that he also has similar obsession. So yeah, that is it.